You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. On today's episode, we are going to discuss fibroids. I know fibroids affect a lot of women. And when you have fibroid, is it necessary that you have to be operated on? Do you always need mammectomy? Okay, so let's discuss. What is fibroids? Fibroids are benign tumors of the uterine smooth muscle. They occur in 1 in 4 females and common around reproductive age group. The exact reason for fibroid is not known, but usually estrogen plays a very major role. It is, however, common among blacks, women that are very big, women with low parity, and also women that are relatively infertile. Fibroids are usually without symptoms, and only in about 25% of individuals with fibroid manifest symptoms, and that's the truth. Sometimes you might not know you have fibroid. It has also been associated with infertility. At that point, you'll be wondering, why am I not getting pregnant? But however, the mere presence of fibroids may not cause you infertility, but evidence is also have shown, and they have made it so that fibroid is usually associated with infertility. Mechanism by which uterine fibroid cause infertility includes distortion of your lining, impairment of blood supply to the endometrium, dysfunction uterine contractility, and it may also increase surface area and invariably a longer distance for sperm to travel. So thereby it might cause infertility when the sperm cannot reach its destination. Mammectomy, the dreadful mammectomy is usually the treatment option when fibroid is discovered, especially when it is occupying your cavity, And after mammectomy, about 38 to 65% women would conceive after the surgery. Of course, during the surgery, the endometrial lining needs to be handled with care. If not, getting pregnant would almost become impossible. Currently, fibroids are known to cause pain in pregnancy, and the view of fibroid causing miscarriage, however, is being refuted. How do you know you have fibroids? As I said earlier, that a lot of women don't know if they have fibroids because most of the times there is no symptoms. But for few, they would experience symptoms such as heavy menstrual flow, irregular menses, pain during menstruation, increase in abdominal size, abdominal pain, chronic pelvic pain, recurrent abortion, and occasionally pressure when you'll be frequent urination. Okay, so you'll be having this pressure to urinate frequently. So let's talk about treatment option for fibroid. Okay, treatment option for fibroid could range from IUI to IVF, especially when the fibroid distorts the lining, making it almost impossible for the sperm to enter, especially when it's affects the uterine contractility. Mammectomy is number one way to remove fibroids, meaning that an open surgery will be done. And this may be necessary, especially for fibroids encroaching and distorting the endometrial cavity called submucous fibroid. Another procedure that can help you to get rid of your fibroid is hysterectomy. That's a total womb removal, and this is not advisable for women who wants to get pregnant. Okay, then laparoscopy surgery also can be done. This is an invasive procedure. Also, uterine fibroid embolization can be done to also help to reduce your fibroid. Then ablation can be done. We have also some devices that can be implanted, such as progestin IUD. Also, some birth control and hormonal drugs would help to shrink your fibroid. Okay, But you need to also discuss all these options with your doctor so that you will know the best approach, okay, the best treatment option for you, okay, because it is not advisable for you to just say, oh, I want to do embryonisation, for instance, or I want to have hormonal replacement therapy, for instance, okay? So your doctor would be able to let you know which one suits you based on your symptoms and your need at that point in time. A lot of women, like I said, they exercise fear when it comes to having myomectomy done. But when it comes to preserving your fertility, I am of the opinion that open surgery should be considered. You know, it should be considered. Although there are instances where some women who have done myomectomy would also experience infertility afterwards. You know, this could just be due to the fact that their uterine cavity or lining was not protected during the surgery. So this is why it is very, very important for you to discuss your fibroid operation procedure with us, so that we'll be able to guide you through on which doctor or hospital can be of help to you. Because our priority at this point is that your fertility should be preserved during the operation. Thanks for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more inquiry, you can comment below, and for consultation, you can send us a DM or call the numbers on your screen. Don't forget to follow us on Instagram at MeetSurrogateMother, and please subscribe to our YouTube channel. Thank you.